So anyway, welcome to all of you. It's so nice to see you all. We're going to rise now for the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're now going to have a moment of silence. We lost recently two wonderful people, Tom Diana, our supervisor, and a wonderful friend, and of course, the late, great Tony Grasso, who we will all always remember for his years of service to this community and as a wonderful friend. So, Jenny, our condolences are with you. Okay. Now we're going to have a special thank you also for our Yorktown veterans and our first responders. Okay, is Ed Lachterman here?
No, Matt's going first.
Okay, we can be seated.
Production vote.
Okay, Wendy, do we want to go ahead and bring the doctor up, and then it'll have to wait?
Matt, what we say?
Yes.
Okay. This is Wendy McNamara from New York Presbyterian.
Hi, everybody.
Always
So
does
nice
so much
to
for us. Yes.
so nice to see everyone. It's almost fall. I missed you this summer. I hope everyone is staying happy and healthy. But it's my pleasure to be here. For those who don't know me, hi, my name is Wendy McNamara. I'm Community Affairs Coordinator at New York Presbyterian Hudson Valley Hospital, and I would like to thank Rosemary and the board for inviting us to come and speak today on the important topic of leukemia and lymphoma awareness. September is Leukemia and Lymphoma Awareness Month. New York Presbyterian Hudson Valley Hospital is your neighborhood hospital, serving the heart of the Hudson Valley with specialties in cardiology, cancer care, digestive health, orthopedics, gynecology, and gastroenterology. I am so pleased to introduce my colleague, Dr. Ronan Harrell, to speak on the important topic of leukemia and lymphoma awareness. Dr. Harrell received his undergraduate degree from Binghamton University, medical degree from New York College of Osteopathic Medicine. He completed his residency and fellowship in internal medicine with a specialty in hematology and oncology from Lenox Hill Hospital, Northwell, Manhattan. He's been practicing at Crystal Run Healthcare in Orange and Rockland County for the last 7 years, and he has recently moved to the cancer team at New York Presbyterian Hudson Valley Hospital. He practices both benign and malignant hematology as well as oncology. We're thrilled he's joined the staff at New York Presbyterian Hudson Valley Hospital's Cheryl R. Lindenbaum Comprehensive Cancer Care. Without much further ado, welcome Dr. Harrell.
So young.
Good morning or good afternoon, everyone. I'm Dr. Harrell. Can you guys hear me okay? Yeah, okay. Wendy, thank you so much for the introduction. I'm new here to Hudson Valley Hospital, but definitely not new to the area. My wife was born and grew up in Yorktown. My in-laws still live in Yorktown. I lived in Yorktown for quite some time, actually, with my in-laws, so it's nice coming back, and thank you for having me. Today we're going to be talking about leukemia and lymphoma. It is the awareness month. I feel like it doesn't mostly get as much credit as other cancers like breast cancer, so it's very big that we talk about it. I'm going to talk a little bit about different types of leukemias and lymphomas, how we diagnose them, a little bit about symptoms and things like that. If you have any questions during this, please stop me, raise your hand, just shout out a question, whatever you want to do, all right? It's a talk that probably could be 4 or 5 hours. We're probably going to put it in for 10, 15 minutes and kind of give the abridged version of it, okay? But before we can talk a little bit about the cancers, I think it's best to talk about how our body works just in general. So our bones are in charge of pretty much making things like bone marrow, and our bone marrow makes the big cells in our body. Our bone marrow makes red blood cells, which carry oxygen to all of our muscles, our organs, and things like that. It makes platelets, which if you cut yourself or something along those lines, it makes you stop bleeding. And white cells, which protect you from infections and things along those lines. Now, leukemia is basically when our bone marrow starts producing white cells that we really don't need and don't function well. And what happens is it crowds out the normal blood cells that we need, and that's a form of leukemia, and our body can't function without those major cells. There are two major types of acute leukemias, of leukemias themselves. There's acute leukemia and there's chronic leukemia. Acute leukemia is kind of like as it sounds. It's very aggressive. It comes on very, very quickly. You have lots of symptoms, things like bone pain, night sweats, fevers, chills, and mostly you find yourself with symptoms and see someone quickly. Chronic leukemia, though, is very, very slow-moving. Sometimes we don't even know we have it. We incidentally go to the doctor. They run some blood tests. They say, oh, your white count is high. What could that be from? And then it's chronic leukemia. Okay? How we diagnose these? Generally, it's on blood work. You go to your regular doctor, you see, oh, your white count is very, very high, and say, oh, what could this be? And then you end up seeing one of us hematologists, oncologists. When it comes to things like acute leukemia and sometimes we need something called a bone marrow biopsy, which is a procedure that I believe gets a bad rep. It sounds terrible, but it's not that bad. I've had it done to myself. But it's a procedure. It takes maybe 10 minutes, and we put a needle in our hip, and we get pretty much a sample of where the bone marrow is made and a piece of the bone, and that's how we diagnose it. Okay? Treatments they range from acute leukemia. It's our hematologist medical emergency. You're generally in the hospital. We give things like chemotherapy, targeted therapy, and things along these lines, and sometimes bone marrow transplants if needed. Meanwhile, chronic leukemias sometimes don't even need treatment. Those are always the fun conversations. You tell a patient, hey, you have leukemia, what are you going to do? Nothing. They always look at you like you have 10 heads, but sometimes chronic leukemias don't even need to be treated. So it's a wide range of things. Sometimes with chronic leukemias, we just have what's called targeted therapy. We take pills rather than chemotherapy and things like that. All right. Lymphomas are very, very different. Lymphomas are cancer of our lymph nodes, our lymphatic system. Lymph nodes, I like to say, is kind of like the garbage system of our body. Whenever you get sick, you have a sore throat or something like that, you'll see large lymph nodes. That's the lymphatic system creating an immune system to try to pretty much get rid of whatever infection's going on. Lymphomas, though, are when your lymph nodes and other organs like this start getting bigger, but not because they're protecting you from an infection, but because something's going on in those lymph nodes. Okay? Like leukemia, there are many different types of lymphomas. We try to break them down to B cell or T cell or Hodgkin's or non-Hodgkin's lymphoma, but there are over 200 different types of lymphomas. All the treatments are very, very different. And they come just like acute leukemia. They come in all ranges and sizes. You have aggressive lymphomas like Burkitt's lymphoma where you need treatment right away, and you have chronic or low-grade lymphomas where you don't need treatment actually, and it's something that we just diagnose and we find incidentally. How we find them is very different than leukemia. Leukemia, like we said, is a bone marrow cancer, so it's made in the bone marrow. Lymphomas, you can show up to your doctor and have normal blood counts and still have lymphoma, because lymphoma is basically a cancer of the lymph nodes, and sometimes we don't see it in the blood. The way we diagnose these is mostly with examinations. First of all, seeing your doctor, having them examine you, seeing big lymph nodes. Two is, imaging, things like CAT scans, PET scans, where we can see these lymph nodes and then biopsy them, okay? Biopsy them is either with a needle or we actually surgically remove them, okay? Treatment's very similar to leukemia. Sometimes they can range from aggressive things like chemotherapy and transplants to really targeted therapy and things that are very, very manageable, okay, like monoclonal antibodies and infusions. And they come in all ranges and sizes, to be honest with you. The important thing that I kind of want to stress, since this is an awareness month, is that these type of cancers don't have screening programs. So we talk about breast cancer, go get your mammogram. Colon cancer, go get your colonoscopy. Cervical cancer, go get a pap smear. There are some cancers we don't have screening modalities from, and these two are one of them. So it's very important that you have symptoms, you see your doctor, you routinely go, because these are things that can be picked up. I'm a little bit of an old-fashioned doctor in the sense that, we can't palpate lymph nodes on iPads. So telehealth, while it's very, very good, sometimes you need to actually see the doctor because you need to be examined and things like that. It's not all gloom and doom. There are very good things that we have going on in leukemia and lymphoma. We have newer things in the last 5 or 10 years. We're making great advancements in these cancers. Certain things like CAR T-cell. You heard me talk a little bit about chemotherapy. Chemotherapy is basically medications that we give, and it's poison to our body, and it attacks good cells, and it can attack bad cells. We're trying to create more targeted therapy. Some of it's CAR T. CAR T is actually, we take T cells out of you, we engineer them almost like in a factory to attack the leukemic cells, and then we infuse them back into you, and we have lots of less side effects, and they're more targeted responses with better responses. We have other things like BiTE cells or biospecific T-cell engagers. I love these. These are great. They basically, we inject them, and it's like making friends with the cancer cell in your immune system. They bring them together, and they let them fight. So it's a good way of having your own immune system actually attack cancers rather than, giving just chemotherapy. So there's a lot of new advancements we have in that area. So I'm going to stop there. Any questions that you have about leukemias, lymphomas, anything at all?
I have a question.
How is that important to diagnose how you feel or faith or whatever?
So blood counts. So to repeat the question, I forgot it's not Mike. The question was, blood counts, how important are they in towards of how you feel? So blood counts, when you talk about blood counts, sometimes we talk about a CBC, which is the general blood counts looking at your white cells, your hemoglobin, your platelets. Leukemias, they generally present with very, very high white cells. So it's a way that we diagnose them, okay? Also on your CBC, we have what's called your hemoglobin or your red blood cells. This is the cells that bring oxygen to all your organs. And if those are very, very low, people generally feel tired, fatigued, and things like that. And when you have leukemias that are really involving the bone marrow, you can become anemic afterwards. So, yes.
Is there an age where there are more cases of leukemia?
Yeah. So leukemia is actually, for the younger generation, for kids, it's actually a very common type of cancer, acute leukemia. The good thing with kids are 90% of them are cured from it because they're able to respond a little bit better than to where we are when we're older. As we get older, the chances of leukemia get more and more. Mostly it's a diagnosis of patients who are a little bit older in their 60s and their 70s. So as we get older, we're more likely to get it. It's not the most common type of cancer by any means, but it's not a leukemia. It's not a cancer that we don't see at all.
How do we keep our bone marrow healthy?
I wish there was a magic to that. If I said exercise all the time and eat your broccoli, everything would be better.
Much iron.
Yeah, there you go. There are things that we know that are bad for your bone marrow: radiation, benzene, certain chemicals. We know those things are bad. Healthy lifestyle, eating healthy, and things like that, they're always good. I can't say there's an exact correlation between certain vitamins and preventing leukemia. We're not there yet. But yes, just a healthy lifestyle is the best thing and prevent different toxins like that.
So I go to my doctor and he does a blood test and my white count is high. They can't just send you the blood. I have to go to another doctor and pay the specialist and get another blood test.
So the question was, I see my regular doctor, the white count is high. Do I need to go see a specialist and so forth? Okay, so white counts can be high for many different reasons. They can be high for an infection. They can be high for an autoimmune disease. They can be high for medications that are caused. So it depends on the clinical scenario. So generally speaking, your primary care doctor can put a context in and say, hey, this patient had strep throat. His white count is 13. I'm going to give him some antibiotics. Have you come back in a week or 2 weeks, recheck your blood count, everything is fine. Because everything that goes up is not cancer, okay? Generally speaking, when white counts continue going higher and higher, or you have a blood counts that keep going on, and we don't have an answer for it, the primary care doctor says, maybe I need to send you to a specialist. The good thing these days, especially, is you can see your blood counts. Now, it's a little bit easier for the good or the bad, from Veritech, you can see your blood counts right away, sometimes even before the doctor see it. So you can look at your blood count from 10 years ago and this and say, hey, it's pretty much the same. I think everything is okay. But, yes, that's the short answer to your. Yeah, go for it.
Could you talk a little bit more about transplants?
Yeah, Sure. So bone marrow transplants, there's two different types of transplants. Oh, I'm sorry. The question was, can we talk a little bit more about transplants with lymphomas and things along those lines? So bone marrow transplants, there's two different types of them. One is where you actually take your own stem cells and give it back to you. And this is a way that we can give high-dose chemotherapy that if we didn't have your stem cells saved, your blood counts wouldn't come back up. And that's called an autologous stem cell transplant. There's something called an allogeneic transplant, and that's mostly with leukemias, not lymphomas, and that's actually when you need a donor. So what happens is we give you a lot of chemotherapy in order to wipe out your bone marrow so you don't have any cells. And we basically get a donor who donates a lot of their stem cells, and you're able to then have their stem cells to repopulate within your bone marrow. And those are generally, we need those not for low-grade lymphomas, but generally for very acute leukemias. Yeah. So sometimes for lymphomas, if there's an autologous, those are your own stem cells. And for acute leukemias, a lot, it's someone else's stem cells that they donate if you're a match.
And where would one get?
No, one would. So Hudson Valley Hospital is not a leukemic and bone marrow transplant center. So you would not be getting it there. The bigger ones that are in the county over here are Westchester Medical Center and Westchester Medical Center in Westchester. And then obviously in New York City, we have New York Presbyterian, Columbia, Sloan, NYU, Cornell, all those are bone marrow transplant. Northwell is one in Long Island. They don't transplant in the city, but yeah, that's a good question.
So I have a question for you.
Go for it.
You had mentioned earlier that there are some leukemias that you'll diagnose, but you'll say you're fine, we're not going to treat it. What is the protocol for how that is handled once it is diagnosed, if it doesn't require treatment right
Yes,
away?
that's a great question. So one of the questions was, if you have a chronic leukemia, sometimes you'll go see the oncologist and they'll say you don't need to do anything. What is the protocol for that? So many chronic leukemias, specifically CLL, chronic lymphocytic leukemia, we don't have any data that says that you're diagnosed with this. By treating you earlier, we prolong your life. So we used to say things like, oh, let's wait and watch. And I got yelled at by a patient because of that, because it sounds very ominous. So we've changed that to active surveillance. And what that means is basically in that criteria is when your white cells are elevated, sometimes they're not affecting your bone marrow. Now, every treatment you have has a side effect. There's no free lunch. So making you or exposing you to that side effect early and having a complication when we don't know that it will prolong your survival, we don't do that. So we generally monitor your blood counts every 3 to 6 months, and if the white count either goes too high or your other blood counts start going low, then we say, it's time for treatment. Or if you start getting symptoms, time for treatment. And there's a whole criteria that we follow that who would need treatment and who would not need treatment. So, yeah.
When you're going through all this, and how important is that blood test that you take I forget what you call it, to find out if you have, if you have cancer in your system?
So,
I forget what it's called.
the question was, how do you know how you're doing?
Yeah, well, how important is it for you to have that test once you have cancer and you're cancer-free?
Yes.
And they suggest that you have that test. How important is it for you to have that test, especially if most of the family members have passed away from cancer?
Are you talking about genetic testing? Okay, genetic testing. So that's a great question. So the question was, how important is it to have genetic testing? Genetic testing has come a long way. We've got a lot smarter, a lot quicker. The initial genetic testing that people probably think about is, and I mention this strictly because I think people have heard of it, is BRCA or BRCA. Since then, we have come a long way. That's a genetic test that we know is involved with ovarian cancer, breast cancer, pancreatic cancer. Since then, we don't just test one gene, we test hundreds of genes now, and there's different genes that are associated with different cancers now, kidney cancer, things like this. So that genetic test, if you have a strong family history of having cancer, specific cancers, you would meet criteria to have genetic testing done. Now, people will say, well, why should I have genetic testing done? A lot of times that can affect how we do surveillance. 2, your family members. If you have it, it's a chance that your family members can have it. 3, sometimes there's risk reduction surgeries and things that we can do in order to mitigate our cancer risks from occurring. So genetic testing is very important. Is it for everyone? No. Okay, and the reason behind that is they're still expensive, although the prices are coming down. And generally, if you don't have strong family histories or personal family histories of cancer, insurance companies won't pay for it. That's one. And the chances of you having a genetic abnormality that we know about are very low. So it's important with strong family histories, and it's always important to ask even your primary care doctors would know about genetic testing at this point.
So would your insurance company would they know whether you have a family history or not?
So
Well, they
asking doctors about insurance companies is a bad start. But the question was, would the insurance companies know if you have a genetic history? So when we fill out the forms for genetic testing, and we do that, as geneticists do that, they make you fill out, does the patient have a personal history? What is the family history? And generally speaking, the insurance companies are actually I make fun of them, not the insurance companies, but the genetic testing companies. We like to poke fun at pharmaceutical companies and insurance companies, but they're very good about it. Generally, if they will not be covered, they'll take your blood specimen and throw it in the garbage rather than running it and sending you a big bill. So they'll know if it'll be approved by your insurance company before they run the test.
So what
Okay.
would the procedure be then?
So the procedure generally is you go to a hematologist or a geneticist or primary care doctor. What would the procedure be? I'm sorry, I keep forgetting to say the question out loud. What would the procedure be? You go to your primary care doctor, hematologist, oncologist. They deem that you're a candidate for genetic testing. They do blood tests. It's a blood test that we do. We send it out. It's not generally done at local places. It's mostly third-party companies. And they run your insurance. And your insurance says, oh, you meet criteria for X, Y, and Z. And then they run the test. Generally, if your insurance doesn't, they send a notice back. It says, oh, it won't be covered, blah, 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 blah. And then generally we throw the specimen in the garbage. Or not us. They do. Yes, we don't do that. Good questions, by the way.
So what do you do then?
What do I do then?
What would you do?
You want to talk to me about fighting with the insurance companies and things like that? You guys sure you have a couple hours? Generally, we ask, first of all, we see if the third party can cover it. Okay, there are different communities and things like that have funding for both cancer treatments and genetic testing and things along those lines. We generally have nice long discussions with the insurance companies that are very, very cordial, that we explain why we require genetic testing and things along those lines, because sometimes it doesn't, guidelines generally, how do I say this, they generally lack what evidence sometimes shows, and we go about that with a nice conversation.
Hematologist, you favor Medicare A and B versus the disadvantaged plans? I think Medicare A and B would never give a doctor a hard time on it.
The question was Medicare A and B, do I favor it over the Advantage plans? I'm going to plead ignorance, okay? I see the patients that come into the office. I don't know what insurance they have, and I treat them all the same way. I am sorry about that. I make it a point not to learn about insurances, okay?
But the insurance companies are lobbying everybody, the patients and doctors,
Yes.
and they don't really break it down. If you need that blood test, you get it.
So, yes, there's a lot of conversations that we do have with insurance companies that we do order tests and they don't approve them, and then we have to fight, and a large portion of my day is fighting with insurance companies to say why we need them and justify them. And at the end of the day, when the physician generally justifies what they are, they generally do cover them, whether A and B or Advantage plans are better. I don't know. I'm back on. Go for it.
Iron, and we keep getting commercials for Geritol, get your iron up.
Yeah.
And you're gonna run like a 16-year-old. Do you have any
Yes.
Geritol, iron?
The question was, is iron and Geritol, if I take it, will I run like a 16-year-old? So it's a very good question. So generally people feel a little bit tired because they're anemic. Anemic is a term for having low hemoglobin or low red cells. The way we make blood is we need iron, B12, and folate. Now, the most common reason for being anemic, at least at a younger age, is iron deficiency. Okay? When you're iron deficient, you have low hemoglobin, you have low hemoglobin, you have less oxygen, you feel tired, you feel fatigue. So if you are anemic because you are iron deficient, Geritol is good, iron is good. I'm not here to endorse any one brand over the other. I think over-the-counter iron is the best thing. However, if you are not iron deficient and you take iron, iron can be bad for you. You can get iron overload. So to take just iron haphazardly is not a good thing. It can deposit in your heart, your liver. We have diseases called hemochromatosis where you have too much iron and they deposit. It's a bad thing. So that's why commercials are good and bad. They make you aware of things, but that's why don't just take them because the commercial says that.
So would your physician tell you if you need to take iron?
Yes. So generally on those, would your physician tell you if you need to take iron? So when you go for a regular physical, you generally get something called a CBC, as well as your cholesterol, your hemoglobin A1C, and things like that. Your CBC will let you know if you're anemic or not. Okay. If you are anemic, generally the reflex test is to check your iron studies. So this is the standard of care type of thing. If you go to your doctor and you're not anemic, chances are you don't need iron. Okay, so they would tell you, your primary care doctor, you don't need to see someone like me for that.
But you can still take vitamins.
Absolutely. So vitamins, you can still take vitamins was the question. So iron is just one vitamin. There are many different types of vitamins. For instance, vitamin D, very, very good for bone health. There's vitamin C, very good for your immune system. So multivitamins are definitely recommended. If you'll see, actually, if you look in the multivitamins, some of them won't have iron for that reason because you can get iron overload. Younger kids, generally, that's not a case, but yes, so not all vitamins are created equal. A multivitamin is great. Vitamin D, we generally get it from the sun. Everyone here in New York, we're all vitamin D deficient because we all have clouds and we use sunblock. So vitamin D is always a good thing. It helps with osteoporosis and things along those lines.
Wonderful. All right. Anyone else have any questions?
Go for it.
In regards to the white count, at what level would you say, hey, I really need to see somebody other than just my internist?
Yeah, that's a good question. So the question is, what white count would you say I need to see someone else rather than my internist? What's the level? So it's not just the number, but there are many different types of white cells. There's neutrophils, lymphocytes, eosinophils, basophils, and things along these lines. So the total number is one area, and the breakdown is another one. The normal level is 4 to 11, okay, or 4 to 11,000, should I say. Generally speaking, if your white count continues to trend up above 11, so it comes 12,000, 15,000, 20,000, and all of a sudden you don't have a reason for it, meaning, hey, I don't have an infection, I'm not sick. That's a reason where we should start thinking maybe it's not just a normal anomaly, maybe there's something else going on, i.e. in the bone marrow or something like that.
But your physician would
Yes,
advise you of that.
Yes, I don't. And the good thing about these, we all have portals now, and these are things that, like I said, you can even see them and you can ask your physician, hey, is this normal? So it's a good thing. It's a good question.
And when you reach a certain age, do you have less or more of a?
That's a great question because we get that a lot. So the question was, as we get older, do our normal numbers change? And the answer to that is no. Okay, I hear a lot of people come in and it's like, oh, I'm anemic. Well, I'm just old. That's not a reason. You get older and then something happens, and that's why it is. Your normal numbers should stay the same through, I don't want to say young adulthood till as you get older, unless there's something that's causing you to have either be anemic, low white cells, high white cells, low platelets, or something along those lines.
No, thank you.
Okay, that's wonderful. Thank
Thank
you.
you.
No
That was
worries.
informative.
Guys, thank you very much for having me. Thank you everything you guys do. My family's been here my wife has grown up here. My father-in-law is here, and we always go to
Wife's maiden name.
She's a Dish. So Pete Dish is my father-in-law. He refs all like the softball games and all those. So if you have a bad call, I don't know him. If you like his calls, I do know him. But the San Severo Festival is fantastic. I always bring my kids.
Glad you came back.
Thank you.
Welcome back.
Thank you.
Thank you very much for having me.
Thank you.
We're gonna do a little switch here. We're gonna have if you don't mind, Mr. Supervisor, we will have our Assemblyman, Matt Slater, on first. Thank you, Matt. How you doing?
Well, good afternoon, everybody.
Good afternoon.
Great to be back here at home.
Is this a familiar surrounding to you?
It does feel and look very, very familiar, let me tell you. Does that seat still move the way it used to?
Yes,
That used to be mine.
I know.
Yeah, good.
I think you broke it.
The wheels haven't broken off yet, have they?
No, no.
Well, that's good. I'm glad that the supervisor's taking good care of that seat for me. Well, it's great to be here with you. I just wanted to come by and thank you to the Senior Advisory Committee for the invitation and for the great work that you continue to do. I want to, of course, acknowledge one of my favorite members of your advisory board, and that's Deborah Marks, who is fantastic and does a great job for the seniors, not just here in Yorktown, but for the 94th Assembly District. So, Deb, thanks for all you do. She's fantastic to have in our office. But yeah, we've been very busy since the last time I've been here, and I just wanted to provide just some quick updates on a few things. First off, I wanted to just make sure everyone knew in the back of the room, we are having our annual senior health fair. It's going to be on Tuesday. If you're going to come, then I'm going to have to play bingo, right? Is that about right? Yeah. But over at Jefferson Village, this coming Tuesday, the 24th. So please feel free to come by. We have more than 50 vendors that are going to be there. We've got a great crowd. I know Wendy's going to be there, and it's going to be fantastic. Yep, absolutely, absolutely. I believe it starts at 10 a.m. to 12. Again, that's going to be in the community room over in Jefferson Village.
I think there are some of these flyers
And
in the back.
there are copies of the flyers in the back. And if you can't make the event here in Yorktown, you feel like taking a ride, we're going to be having another one in Patterson, another community that I represent up in Putnam County. And you're more than welcome to come, and that'll be on October 8th from 10 a.m. to 12 p.m. That's up in Putnam County in Patterson. But, so we've been hosting some great events in the district, trying to make sure that everyone gets the resources that they need, that they deserve. I know that the supervisor is going to touch on Shed the Meds, which was a great event that we had, and I'll have him get into that a little bit. But I think it's really important for everyone to just remember, if you have any unwanted or expired medications, you can always bring them to the police department. There is actually a drop box right in the lobby. So please, just don't let those fester in your medicine cabinets. Unfortunately, the opioid epidemic has once again ballooned here in the state of New York and across the country. Unfortunately, the statistics show that we continue to lose more than 5,000 New Yorkers every year to an opioid overdose. It's more than 5,000 New Yorkers. And if you dig deeper into the statistics, the Department of Health tells us that more than 90% of those deaths are caused due to illicitly manufactured fentanyl. And so it's a very dangerous situation and something that I think we all need to come back together to address as a state and as a country. I had the privilege of working with a fellow Yorktowner, Lion of the State Senate, Terrence Murphy. And when Terrence was in the New York State Senate, he co-chaired the Senate's task force on opioid abuse. And we actually traveled the state of New York. About 2016 we were doing this. And we just heard horrible stories about people suffering from addiction and the perils of the opioid epidemic that was going on then. And we started making some really good progress with some important legislation that Terrence was able to pass in New York State. But we saw once the pandemic hit, it just exploded on us again. Just horrible. And so we have to recommit ourselves to this cause and something that we're going to be focusing on moving forward. But I do want to thank our supervisor, Ed Lachterman, and the Yorktown Police Department and all of our partners who joined us at the Shed the Meds event last week. We also, this summer, we were able to recognize Yorktown's first historic business. The state of New York actually has a program that if you're in business for more than 50 years and you get nominated by a state legislator, that you get to be added to the state's historic business registry. Well, Reliable Oil, located right here in the Heights Hamlet, has been in business for 85 years. And the Mastros are just staples of this community, fantastic people. And so we got to nominate Lou and Serafina and the Mastro family and their great business as Yorktown's very first state-recognized historic business, which was great. And I know the supervisor was on hand for that, as well as Sergio Esposito, our town councilman, deputy supervisor. But yeah, Reliable Oil dating back to 1939. Yeah. Pretty amazing, right? And that's been one of the great things that we've been able to do during my first term is being able to nominate. We've nominated several businesses across the 94th Assembly District, but Reliable being the first here in Yorktown. More recently, I just want to touch on a couple more things that we've been working on. One of the things that we've been hearing a lot from our localities has been large-scale battery energy storage systems. I'm sure you've all driven up Route 6 and you've seen these big yellow signs in Baldwin Place talking about a battery energy storage system. It would have been the second largest in the state of New York. It straddles, I should say straddles. It's not past tense yet, but it straddles the border of Mahopac and Somers. And the first, actually, pad of these energy storage systems, these batteries, would have been 200 feet from this one neighborhood's backyard. I was actually there yesterday with a bunch of the residents off of Lonesbury Court in Somers. And so talking with the supervisors of the 94th Assembly District, Supervisor Lachterman, Supervisor Scarano, every supervisor that I work with in this great district that I get to represent, this is an issue that each one of them are tackling collectively. I know that the town board is putting forward measures regarding battery energy storage systems, large-scale battery energy storage systems. And so one of the things that I think is really important is home rule. We are a home rule state. What does that mean? That means that the municipality and those elected to represent the municipality should be having a say as to whether or not a project is approved or rejected. Unfortunately, in New York State, that seems to be withering away. And there's a few examples of how that's been happening, specifically as it relates to renewable energy projects. These large-scale battery energy storage systems is one of those types of systems which is teetering, not yet, but teetering on the point where home rule is going to be taken away on these projects. Thankfully, right now, this particular project would still fall into the realm of home rule. However, and I debated this on the floor of the Assembly, and we got very specific answers to my questions on this, if it was connected to solar panels, the state can come in and actually require it to be approved without municipal consent. I think that's wrong.
I do too.
I just think that's wrong. That's not what. That's not how we operate. That's not how I operated here as a town supervisor. That's not how the municipalities and the municipal officials that I work with want to operate. And so we've introduced legislation that would do two things. First off, the state has yet to actually provide additional protections for the watershed when it comes specifically to battery energy storage systems. And so, number one, we need to make sure that our watershed and our environment is properly protected. And so we make sure that there's added protections as part of the approval process. But secondarily, my legislation would require consent from the municipality in order for any of those types of projects to be approved by the state of New York. And I think it's a very important measure for us to take because at the end of the day, listen, a bureaucrat from Albany does not know the community better than your town board, right? And so I think the town board needs to be the deciding factor in these decisions. And I will always stand up for home rule to make sure that whether it's a bureaucrat or someone else in Albany, those decisions should be made here on the local level, and that's something that I'm fighting for very strongly about. The second one that that you're going to start hearing about, I have two kids, both of them in here Yorktown School District. I graduated the Yorktown School District. It's pretty cool. Now Charlie goes to the same elementary school that I went to. Charlie's over in Crampond, and it was funny. We went over there in the summer, and I said, "You see that window? I put a soccer ball through that window. Don't you do the same?" But that's the great thing about living in this community and now getting to raise my own family in this community is that you get to share those. He said, "You broke a window?" And that's what he said. I said, "I think it's a different window now. Don't worry." But one of the things I want to make sure that our kids, whether my kids or future generations, we just recognize the 23rd anniversary of 9/11, and I think it is critically important that every child understands what 9/11 did to our society, what 9/11 did to the state of New York. And I'm not saying that it's not happening, but I want to ensure that it does happen. Each child. If you remember when I was town supervisor, we actually had a flag garden outside around 9/11. Our town clerk, Diana Quash, remember? We did that. And we had one flag planted for every single person who was killed that day. And we actually had the youth of the community. We had some of the football teams, the young YAC football teams come down. Scouts came down because I wanted kids to understand this. They don't understand because they didn't live it. And I think it falls upon us. When we say we never forget, it also means we have to make sure that we're reminding and teaching those who weren't here to experience it. Now, over in Somers, there was an incredible individual who, you know, he's a hero. And his name is Joe Spohr. He was a member of the FDNY. Joe had just gotten off his shift with the FDNY when the attacks occurred. He was driving home. Joe turned around and went back. And he never came out of the towers.
Oh.
That is a hero.
Yeah.
That's what our children should understand, that yes, there was evil that had happened that day, evil that took the lives of nearly 2,000 people, but there were also these incredible heroes like Joe Spohr. And I think it's important that they know about Joe. They know about people like Joe. In fact, the town of Carmel, now that I think about it, the town of Carmel is actually hosting the 9/11 Mobile Museum next week at the Mahopac Fire Department on Thursday and Friday. And so I would encourage everybody here and anyone listening to please go pay our neighbors in Mahopac a visit. But I think it's important, like I said, that every child is taught about 9/11. That's why we've introduced a bill named after Joe Spohr that would require all schools in New York State to teach about 9/11, both now and moving forward, because I think it's that important and an important part of our history. But with that, like I said, it's been a very busy time of year. I am very happy to share that we've closed out more than 1,000 constituent cases in our first 18 months. Representing you in the 94th Assembly District. That's a big tribute to my staff who are here, so please give them a big round of applause. They do incredible, incredible work. And, you know, as we're wrapping up our first term, I think that we've done a really fantastic job representing everybody here in the 94th Assembly District. You know, we've delivered more than $32 million to the district, brought it home, and that was all that went to things like new roads, new bridges, supporting our libraries. I just came back from the John C. Hart Memorial Library, which I know the supervisor is going to talk about some of the great things that continue to happen there. It also goes to supporting our law enforcement. Yorktown Police Department, one of the agencies that was able to receive a DCJS grant that we were able to help support and secure for them as well. And in addition to the money that we've been able to bring back from Albany, happy to also share that I've passed the 7th most pieces of legislation of any freshman out of 32. That's Republicans and Democrats. And so I think it really shows our ability to reach across the aisle and work with everybody who's up in Albany in just trying to find the right solutions for the things that we're dealing with every single day. And that's something that I'm also very, very proud of. So with that, I'm happy to open it up to any questions. It's always just an honor to be here. And Mr. Frank, you reminded me, and I forgot something. So if I could quickly, before you ask your question, because the last time I saw you was at the Grange Fair, and I hope everyone enjoyed the Grange Fair. It was fantastic. Their 100th. And we also were able to secure the Yorktown Grange a $50,000 grant to make sure that they were able to continue their operations. Because, listen, the Yorktown Grange is our history as a community. Mm-hmm. We were an agricultural community for generations. And when you go visit the Grange, you're reminded of that. And I think it's really important that we're preserving that history, but also that education. And they've got some great vision on how they want to educate future Yorktowners about everything Yorktown stands for, which I think is very important to support. And so thank you, Mr. Frank, for reminding me of that point, because the last time we were together, we were having lunch over at the Grange.
You did a great job, but I'm surprised that the Public Service Commission hasn't addressed the battery storage, not only for safety, but the storage and the money that they're making as far as getting that electricity back into the community for a lower rate.
Yeah, Mr. Frank's question, and I was told by our producer in the back to echo the question for folks watching at home. He's clapping. I hear him. Still got you. I still listen to him after all these years. But anyway, Mr. Frank, yeah, the question Mr. Frank posed is about the PSC and large-scale battery energy storage systems. You know, the state a few years back passed a bunch of legislation that really started transitioning us to more renewable energy sources, which I think is important. You know, understanding the impact that climate change is having. I think we see it every summer with the storms that we continue to have. But at the same time, what I think, Mr. Frank, what your question really drills into is the PSC, the Public Service Commission's role. The Public Service Commission is the commission that actually approves the energy rates that we are paying right now. And I can tell you, from the folks that I talk to who reach out to my office, the number one issue that we're dealing with right now, and Deb can echo this, is people who are struggling with their utility bills. And that's because the supply rate, the amount of money to actually create or generate electricity is going up. The Public Service Commission, if you're in NYSEG, did approve a more than 30% increase for your delivery rate. And you're also seeing as the utility companies have to shift and implement these policies focused on green energy, there is a cost to that. And that cost is being passed on to ratepayers. And so all of that is, I think, really putting a lot of pressure on people financially, especially our seniors on fixed incomes. I mean, I remember we were in Jefferson Village. I think you were with us, Supervisor. We had that rally in Jefferson Village a few years back. I know that our good friend Tom Diana, who was my deputy supervisor at the time, was with me. And people were really struggling at that point to pay their utility bills. And they were being forced, especially on fixed incomes, to choose between medication and food or if they were going to be able to heat their apartment. And it's a serious, serious problem. And half the problem is that I found there was never any cost-benefit analysis or cost estimation with the policies that were being passed at that time.
Right.
So no one has any idea how much the cost, what the true number is to implement the policies that were passed. And the bill keeps coming, and the utility companies are passing on the costs, unfortunately, to the consumers. So there is a cost associated with it, and that's part of the reason I think that the PSC has been rather quiet on it. Because, listen, I'm no fan of the PSC. We've asked them, we demanded that they come down here to Yorktown to hold a public hearing when they did the 30% rate hike. They refused to, so I put in legislation that said if you're going to raise the rates of utility customers, then you have to at least come and do an in-person public hearing so you can hear from the ratepayers themselves, because they denied us here in the Hudson Valley that opportunity. I also put in legislation that would require, when there's a supply cost increase, a spike like we saw during that time in Con Ed, that the utility companies have to disclose that because they weren't doing it in a way that consumers understood. And I think it's important for you as a consumer to understand, why is my bill so much higher than it was last year? And for NYSEG customers, I'll also just say this. There has been smart meters being deployed throughout NYSEG's region. That's part of their rate case. They're required to do that as part of their rate increase with the Public Service Commission. And there have been erroneous bills that we've been dealing with. Some that were, there was that one individual in Brewster. It was a $400 discrepancy from what they actually owed.
Oh my God.
So make sure you're reading your bills. If you have any questions, if you have any concerns, if you think that it's just an exorbitant bill that makes no sense, why did all of a sudden my bill go up $100, $200, $300, $400? Feel free to call us, and we'll get you in touch with the right people over at your utility, whether NYSEG or Con Ed, and we'll do our best to help you get a clear and concise answer on that. But that's one of the things that we've been dealing with.
Okay, Matt, this way. You recently wrote legislation which would provide tax exemption in regards to seniors.
Yeah. I'm happy to talk about that. So as a senior, if you're retired and you spend, you do the right thing, right? Yeah. And you spend your working days putting away money in a 403B or some type of retirement savings. In the great state of New York, we actually tax you if you withdraw more than $20,000 out of that account. $20,000. If you go to New Jersey, it's $100,000.
Big difference.
And that's your pension plans.
That is a private pension plan.
Yeah.
Correct. And so if you have a private pension that you were using as your retirement plan,
yep,
and you need to withdraw more than $20,000 in the state of New York State taxes you. It hasn't been adjusted since 1983. So I've introduced legislation because, listen, if we want people to be able to survive here in New York, and when I go around my district, it's about affordability, opportunity, and public safety. That's what people want to talk about. That's what's on everyone's mind that I talk to, that come to me, that come to our office, are those three things. So if we want to stop exporting our residents, and by the way, we lead the state in out-migration. We've lost more New Yorkers in the last 2 years than any state in the country because of the cost of living. Yep. And so if we're taxing our seniors who are on a fixed income, what do you get for $20,000 these days? Can you afford to stay in your home for $20,000? Nope. So if we want to be serious about making it more affordable, then we have to take steps to make it more affordable. My legislation that I propose not only raises the cap up to the $100,000 to match New Jersey, but it ties it to the rate of inflation so that we never have to do this again. So that as the cost of living goes up, so does the exemption.
It seems fair.
Well, you would think it seems fair. I think it's common sense. If the state of New Jersey can do it, why the heck isn't the great state of New York doing it?
Exactly.
So that's one of the things that that we're fighting for in Albany. We think it's critically important, especially obviously for our retirees and seniors. Listen, my mom still lives in the house that she raised me in, and I want her to stay there. She thankfully right now she's still working, but when she gets to the point of retirement, $20,000, no, that just doesn't cut it, folks. And you shouldn't be penalized because you're just living in the wrong state. And frankly, that's what's happening. And I don't think it's right. And so we're trying to fix it.
Will you
And I
keep us
think the
informed
fixed
on that?
income is a very key parameter.
The fixed income is, yes, absolutely. And yes, I will. Once we get back up to Albany, thankfully, and I say thankfully because when we're in Albany, all that happens is, spending and taxes. But when we get back to Albany after the election, then I will absolutely be keeping you abreast of all the movement that we get on our legislation.
I
Including that
think
one.
it also included it has to do with child care.
So childcare has been a big issue that I've been tackling head on as well. Do you know it costs more today for childcare than it does for an in-state college tuition?
Yeah.
That's how bad it is. And, we are trying our best. I've introduced almost as much legislation on trying to make childcare affordable as I have on trying to fix the cashless bail laws. But the childcare issue is a big one. And again, it's on average $21,000 for childcare in the state of New York. If you're a single parent, on average, that's 60% of your income. How do you survive here on that? And again, I was raised by a single parent, so I relate directly to that statistic. 60% of a single parent's income just to get your kid to childcare so you can go to work. Childcare is an essential service. I mean, I'm thrilled that we've done a lot with UPK. UPK has been a godsend in our communities because it's helping parents all across the district. Yorktown has implemented it. Lakeland's implemented it. Mahopac has implemented it for the first time this year. Same with Brewster, so that program is growing. But childcare really has to have a real concentration and discussion about childcare in New York State because it's just completely unaffordable. Other questions that I might be able to answer? Yes, ma'am.
Do you have anything to do with getting IDs for voting?
So IDs for voting. I have a piece of legislation that would require it's the voter ID bill. In New York State, you do not need to show an ID to cast a ballot. I personally think that's wrong. I think it's, you need an ID to do anything these days. You need an ID, obviously if you're going to go purchase tobacco or alcohol. You need an ID just to get into a hospital, right? If you're going to go visit a loved one, you need an ID to get in as a visitor.
Right.
But you don't need an ID to vote. I think that's wrong. And so I've introduced legislation that would require proof of voter ID. It's called voter ID, but any type of government-issued identification in order to cast your ballot, whether that's a license, passport, whatever it is. And most people, to be honest with you, I mean, you talk to the poll workers, people are coming up, they're showing their ID anyway.
They are, yeah.
And the poll workers are saying, no, we don't need to see that here. Wouldn't you want to know that the right person is casting a ballot? I just think that, again, it's a common sense measure that we should be implementing.
They show their card that they get in the mail, and I say to them, we don't need it, but I'd love to see it because if we scan it, it goes right through.
Right, yeah, from the Board of Elections.
You have to give it to me, but thank you, I'll look at it anyway.
Yeah,
Is that a
exactly.
registration card?
No, it's the one that
You get it in the mail.
Yeah, the Board of Elections sends out a notification that tells you your polling location.
But when you register, don't you need an ID that demonstrates
So here,
that you're a citizen?
you want the truth?
Yeah.
So when you register to vote, you need a Social Security number or driver's license, right? And here in the state of New York, they've passed legislation that non-citizens can now get driver's licenses.
Oh, well.
Okay? So you can get a driver's license as a non-citizen, and then you put your driver's license on the voter registration, and all you have to do is sign the bottom of the form.
Wow.
There's no check. And someone brought this to my attention. I said, you're crazy. that's just ridiculous. You have to, the Board of Elections have to check this. And I've spoken with the Westchester County Board of Elections. I've spoken with the Putnam County Board of Elections. I even called the New York State Board of Elections, and they said, no, Assemblyman, there is no process or procedure in place. If that person signs the bottom line stating that all the information above is accurate and correct, then we register them to vote. So there's a piece of legislation that I've introduced. There's a program called the SAVE program. It's a federal program that about 6 other states have opted into, and that's the Systematic Alien Verification of Entitlements program. Again, federal. So you have like Arizona's in it, Colorado's in it, and several others. And that is a program that's in place that can actually verify that those who are trying to register to vote are in fact citizens and they can vote. And I think New York should actually participate in that program, just as a verification aspect. And so I've introduced legislation to opt us into that. So we would be the next state to do it.
Matt, what's the current status on the $60 million state fund to assist in local roads?
So local roads, yeah. What's the current status for our local roads?
Yeah, $60 million.
I'm guessing that's the CHIPS money that you're referring to?
Yeah, the state.
So the state allocates dollars every year for CHIPS, which is, and the supervisor can speak to this and set your budget, as can your highway superintendent. I think it's our highway superintendent's one of his favorite things is his CHIPS budget. And so that is the money that the state allocates to each locality, each municipality, so they can go pave local roads. Not your state roads, not 202, not 6, none of those, but like your Quinlan streets, your Barger streets. Did I say that right? Barger, right? In memory of our good friend, Tom Diana. So local roads. The governor actually proposed in her original budget to reduce your CHIPS funding for the state of New York. And, you know, thankfully, we've got some great highway superintendents here in the Hudson Valley who raised the flag, including Highway Superintendent Paganelli. And he actually educated us to the fact that the cost to pave has gone up because of everything else, right? Because of inflation, because of supply chain, just the cost in general. So I believe what his statistic is, it was originally $80 per ton to pave, and now it's up to $120 per ton. But the governor wanted to cut funding so that we couldn't pave our normal schedule of roads. Meanwhile, not increasing it to stay with the cost of inflation. You know, the investments in infrastructure, I think, is one of the missed opportunities as a state every single day. I actually joined a bipartisan coalition of Hudson Valley lawmakers, and we wanted to include a $400 million increase specifically for our state roads. That would be your 202s, your Route 6s. I mean, listen, I drive on them too, right? I'm not going to be nice about the conditions. They're terrible.
Yeah.
In fact, Region 8, which is where we live, the Hudson Valley, has the worst rated roads and bridges in the entire state of New York.
Wow.
It's a fact. But yet we don't get the money to fix the roads. Go figure. Anyway, and so we actually put in a proposal during the budget process last year, Republicans and Democrats, all from the Hudson Valley, for an extra $400 million that would go to that exact problem, and the governor rejected it. You had the Assembly say yes, you had the Senate say yes, you had Republicans say yes, you had Democrats say yes, and Governor Hochul said no. And so it was never part of the final budget. And I think that's a horribly missed opportunity. And it's a real quality of life issue, right? I mean, you know, safe roads are so crucial for every aspect of our lives. Not to mention, quite frankly, around here we pay some of the highest property taxes in America.
Right.
We should have decent roads to drive on. But unfortunately, the funding becomes to be more of a political football than anything else. And I think that we've really not invested in the right way, specifically for our infrastructure. But we're going to make sure every year, we're going to make sure that when I'm there, that we're going to make sure that the CHIPS funding is adequately funded. It needs to be increased. It hasn't been increased in a number of years. And so, again, even though we're saying, great, we gave you the same amount of money that you got last year, you're not able to pave the same amount of road because the cost has gone up. You know, that's where I think politics gets in the way, and unfortunately the state just doesn't do enough for us. Any other questions? Because I know that the supervisor's been patiently waiting. Yes, sir.
Is there any discussion on road specification? Because the roads last the term. And I've talked to people that are in that business, and if they were spec'd differently, our roads could last twice as long. But it doesn't seem that anybody wants to address quality.
I mean, I can't, not specifically that I've engaged in a conversation about respecing the roads. What I can tell you, though, is that our highway superintendent, he's done a great job on milling roads rather than just overlaying, and that seems to have had a very positive impact on the duration of those roads. But there's an additional cost to that, right? So, you can do double the roads if you're just going to overlay the pavement, right? But if you're going to do it so that you get long-lasting roads, you have to mill and fill, and the mill portion of it adds another cost. And so, again, if we're trying to pave more roads, but the cost keeps going up, but we're giving you the same amount of money, you're getting less for your dollar. And that, I think, is wrong.
Yep, I agree.
All right, thank you.
Thank you
All right.
very
Always
much.
great to see everybody. Thank you, Yorktown. Always great to be home. Appreciate it.
Have a good day.
Wendy, did you want to hand out something?
Yeah, I'll discuss it, absolutely.
Okay.
Do you know this guy?
I've seen him once or twice.
Okay. Now, without further ado, we are going to, I think our supervisor is jumping out of his seat. This guy who's supposed to be on. Ed Lachterman.
Thank you. How's everyone doing today? And next time, don't have me go after him. He speaks about everything.
I know it. I know.
That's borderline.
He told me you agreed.
Yeah, no, that's fine. All right. How's everyone doing today? Good? Anyone get a chance to go down to San Gennaro yet?
Not yet.
A lot of fun down there. It's good. And this weekend, hopefully, it'll be really packed. I want to talk about a couple things. Matt mentioned our library. I don't know if everyone knows what's going on there. So back in 21, we put aside some ARPA money, the American Recovery Act money, for some things there at the library. Our library services the second or third most amount in the entire county, including the Yonkers library systems and White Plains, New Rochelle, which are cities. We have a terrific staff. We have some great people that do a tremendous amount of work there. And the great thing is they listen to our community. One of the things that has been missing there are places where you go in with a group and do a study group. So we now have 5 study rooms that were put into the back. They rearranged, and they have like a nice little back nook where people could sit in some comfortable chairs. They put one of those little electronic fireplaces in, and it's an area with great windows and lights. So, that's some of the improvements that they've made there. And today we did the ribbon cutting. I am sure it'll be in my supervisor's newsletter next month, so you'll be able to see a little bit. But I highly recommend stopping over there. And they have some great plans. They converted some dead space because we had gotten some grant money for LED lighting. So they took some space downstairs, and they were actually able to make it usable space because it didn't feel like you were in a dungeon anymore. They are going to be looking to do a expansion of the library that they are going to go and try to do fundraising for, not at the expense of the taxpayer, but to try to increase the room there, because really they're running out of space for all the programming and everything they do. They do a tremendous amount of programming, and they have coming up, I believe it is the last weekend before Halloween, they will have their haunted house, and we'll make sure that we get some of their information out as they get us. But it's done through volunteers in the community, a lot of kids from the schools, and they did it last year. What an amazing job. And it's just, it's a really cohesive place for our community and our kids to go to, and they're people of all ages. I was there today. I saw my neighbor walking out with her preschool son, and I saw a couple of seniors that I know, and just everyone could go in there and use in this programming for all. So really some great
And
things.
Yvonne does a wonderful job.
Oh, she's phenomenal.
Incredible.
I spoke about it earlier when we cut the ribbon. It's not a library. It's a community building. They really know the community. They work with the community. They care about the community, and they're really, really great. I didn't mention the 5 rooms. They have not been named as of yet, but I understand that our museum helped out through the clerk's office to get some pictures and maps from the different hamlets of Yorktown, and each of the rooms will be named after a specific hamlet in town. I love the old map that they have a copy of in there. So, but some wonderful things there, and they're going to keep moving, and I really recommend signing up and watching. I'll be hitting some questions after, if that's okay. So, Shed the Meds, Matt really spoke about everything there, except that we filled up the boxes twice within the first hour. And there was someone who brought in their medications that it had been 10 years worth of medication.
Oh.
Right. You do not have to wait for Shed the Meds event. That box is in the police station lobby, and you could go there 24/7. Our police department does not rest, as we know. And you could dispose of your unused medications there. Also, something I am surprised that Assemblyman Slater did not put out, but he worked on a law to make it so your pharmacies have to take back those medications also.
That's a good idea.
So you can bring those to your pharmacy and ask them to dispose of it.
That's good.
But if you feel more comfortable getting rid of them yourself, you put them into a Ziploc bag or a plastic bag, take them out of the plastic container, you could discard those, and you bring them right to the police station. You buzz in, and it's right there. You could drop off your medications. Matt, Carol, if I could come back at the end, that would be, just so we could get through. Matt spoke about home rule, and I've been speaking about this quite a bit too. I think that Albany is overstepping in what they want to do, and there's been housing home rule things where they want to discard our zoning laws, the utility laws. There's quite a bit there, so please keep that on your radar. I think when we talk about the community of Yorktown and all the different communities around us, it was really a bipartisan push against this, especially in Westchester County, because one of the home rule objections that they have in our zoning is they want to be able to take land. So right now there's a planning process. So if I want to put up a building on a piece of property, so for housing, I have to go through planning and I have to go through a specific process. What Albany had pushed to do, and fortunately our legislators fought against it, was they wanted to allow me, if I owned that property, to go in and pull a building permit if it was within a mile of a transportation stop, which could be a bus stop, train station, and I could put a 5-story building up as of right. Doesn't matter what the zoning laws are.
That's right.
So there's really, really a push from Albany. It got canceled this time, but I personally don't know if it's an inevitability, and I think it's an overstep of government, especially in our community. As Matt put it, you elect officials here that are supposed to make the decisions. You might not like our decisions, and that's fine. But we need to try to push through what we feel keeps a character and makes things work the best in our town. And I don't think it should be someone from Albany. You know what? Someone who lives in the Bronx or Manhattan and represents them has a much different view of what someone who represents Yorktown Heights is. So, and I lived in Cobleskill for 2 years while I went to school there. Much different outlook in Cobleskill as it is to down here. So really, it should stay within the community, and you should have that right. The Grange was fantastic. I'm glad Matt brought up the grant. A lot of things that need to be done there to keep that building there. The Grange has been looking for volunteers. I know they convinced someone sitting to my left to join as a volunteer recently.
That's true, and I just want to note that Senator Harcum has given them also a $100,000 grant.
Oh, fantastic. That's great. So now the Grange will really be able to get some of the things done. That's fantastic. So I think that'll be about 150, because I think Assemblyman Slater's grant is $50,000. So we'll be able to do some work there, and he spoke about the CHIPS Act and the paving, and we as a town board have been committed since I've been on the board to moving aside extra money out of fund balance, which is determined by how we run the town. So our people have been able to run their departments and save money as our fund balance has crept up. We didn't really want to do much during COVID, not knowing what would happen with revenues. But this year, again, we have pushed aside $1.2 million for additional paving and milling and taking care of our roads because we want safe conditions for everyone. So that's something that we took care of over the summer. A couple things just to keep in mind. Who here used to go to Nathan's?
Oh, yeah.
Yeah?
got rid of-
Now, anyone go to Brooklyn?
No.
Coney Island, Nathan's?
Coney
No,
Island.
Okay, yeah, okay, yes. Oh, you worked there. There you go. I went with my dad. My mom was from Brooklyn. My dad originally from Queens. But he, when he was in town, we would go down and have Nathan's down in Coney Island. But we have our own Nathan's in Mr. Softy. They're going to be doing a ribbon cutting next Thursday night. And they're going to have from 5 to 7 $2 hot dogs and $1 cones. So I'm telling people about it because those Nathan's hot dogs have gotten expensive. So
Where's it going to be?
right in the CVS Plaza at the Nathan's and Mr. Softy. Yep, it's the old Subway spot.
What's the date?
Thursday the 26th, I believe. Jim, am I right on that date offhand? Thursday. Okay, Thursday the 26th. Great. And also coming up, Matt spoke about his festival or resource fair, but the Chamber of Commerce does a fall festival, which is a Sunday of Columbus Day weekend. That's at the Jefferson Valley Mall. That's on the 13th, and they also have a lot of partners in the community, including New York Presbyterian. So there are a lot of people there that you go and meet, and some additional resources there, as well as some fun things to do as well. And you'll see a lot of people from our community, and some of the groups. The Lions will be there, and you could go and meet different organizations if you want to donate your time to a cause, and you can really get some great information. And Wendy, you had a comment?
I just wanted to say that once again, New York Presbyterian is sponsoring the senior luncheon.
Oh.
For seniors at the Chamber Festival.
So New York Presbyterian is donating the lunch again
Okay.
this year. It's sponsoring the lunch. So free lunch, and you have to go get a ticket for that and go upstairs. So and how do they get a ticket?
Go see the main information booth with the Chamber.
All right, main information booth with
And
the
what
chamber.
day? On Columbus Day? Monday?
No, it's on the Sunday, the 13th.
Sunday, okay.
Yes. And they usually have an auto show there, so there's something for everyone. All right, I know there were some questions.
Yeah.
The library.
Yes.
Their book sale is next weekend.
Thank you. Yes, and I just saw Pam, who was drumming that into my head. So next weekend, the library will have their book sale. I believe it's Saturday and Sunday?
Friday, Saturday,
Oh, Friday, Saturday, and Sunday.
members who are members of
Members of the library on Friday, Friends of the Library, and then Saturday and Sunday open to the public. And we were actually going to, I put her in touch with our communications people, so they're going to be doing a press release on that. But thank you.
Ed, would you tell them about Patriot Park? Aren't we going to have something down there?
Well, it's not Patriot Park anymore. Veteran Memorial Circle.
That's what I wanted you to tell them.
Yes, so there was a renaming of the park behind us, behind the skateboard park, where we have our military flags and all of our military memorials, and that is now called the Veteran Memorials Circle. We have memorials for World War I, World War II, Korea, Vietnam, the War on Terror, and is there a separate Afghanistan as well, correct, Jimmy? Thank you. So we have a project going on by the Garden Club. Anyone here like gardening? Wow, no one's raising their hands. I see one nod. I see a lot of husbands going, "Oh my God, I do this at home." No.
I love it, but I can't do it anymore.
So the Garden Club is doing a whole renovation of the garden down here with native plants. which are extremely important versus the invasive species that are around. They're great pollinators, and you could walk down there and take a look. Jimmy, do you know the date that they're doing the final? Because I know they were flagging everything. We don't have a final date on that. All right. So if anyone's interested, you could look up the Garden Club of Yorktown online. And they are also, if you do love the flowers, love the gardening, and really believe in it, but can't do it any longer, they are looking for people to help donate towards the purchase of the flowers. They're trying to raise $10,000 in total. So there's also that available that you can contribute in some way if you don't have the body to get down in the dirt anymore. And I'm very familiar with that with my disc herniations. Right, exactly. It's not getting down, it's getting back up again. It's the problem. I agree wholeheartedly. Carol, you had?
Is there someplace in Yorktown where you can drop off needles, like an EpiPen needle?
Yeah, that's a great question. My cousin who was diabetic passed away down in Florida, and they actually had the police would come and inventory your drugs there. They didn't have the drop box. If you speak to who do you use for your pharmacy? At Raj, Yorktown Pharmacy?
Still here.
Oh, drugs.
Jefferson Valley. Ask them. They might actually be able to take them back for disposal. Wendy, do you have any ideas about? No. Okay. But I know it was, I had to go through a whole thing to figure it out down in Florida. I have never done it through here. But I'm going to have to anyway because I have a Sharps container that's going to have to be disposed of sooner or later. But you could also probably ask your doctor's office.
They don't know.
They don't know?
They give you a bill. Don't
Yeah, you have to make an appointment.
Wow. We're jumping on the insurance and the doctors today. All right. Anything else? Anyone have any other questions that I could help you with?
Thank you very much.
Thank you.
No, but I just want to say, having an event for Shed the Meds ensures that people think about taking it out. You know, it's all well and good that we have them, but they don't think about it. So having an event like you had is wonderful because it says, oh, maybe I ought to look.
Yeah, she's right.
Yeah. You know, I will take one more minute because the importance of it. A lot of people don't realize it, but there's a huge importance in getting rid of those medications. Who here has children and grandchildren that might come over to the house?
Sure.
Raise your hand. Let me see. Children or grandchildren? Right. Right. Yep. So unfortunately, what happens nowadays is children that don't, young and dumb, as they say, there are some kids who will go out and they think it's a great thing that they'll say, grab a bottle of pills, we're going to dump it into a bowl and have what they call a Skittle party.
Oh, my God.
Where they pick pills, not knowing what they are, what they do, and they take them. I cannot think of anything more dangerous, especially if they're mixing things that have contraindictions. So that's just one thing. Anyone ever sell their house or sell an apartment or the condo that they were living in?
Yeah.
Because some people go around to look at houses and look at apartments for sale, just so when they usually ask you to leave. They usually go as a couple. One will say, oh, can you show me this room over here? And the other goes into your bathroom and takes your medications out. And then they sell them.
Oh.
Yeah, there are people that make a living like that. Look, the scams out there, as we all know, are horrendous. But here you have people, some people are doing it for monetary value. And sometimes you have people with just really severe addictions who are looking for something. So I can't stress how important it is to get rid of that stuff and get rid of it properly. You don't want to dump it down the drain. You don't want it in our water system. But there's a way to get rid of it, and it's available. And look, you could, if you can't get there and you have a neighbor that you trust, they could do it. Or once again, every year we will do it at Jefferson Village, and now you have the option of utilizing your pharmacies. So,
The needles. I found the answer to
oh. What you could you want? Yes.
It says you can bring properly You can bring properly packaged and labeled used syringes and lancets, also known as sharps, to any hospital or nursing home in New York State. New York hospitals and nursing homes are required by law to act as collection centers. You should contact the hospital or nursing home first for specific drop-off days and times.
Very good.
Thank you, Deborah. I think I think you could count that as another constituent case closed.
I'll check and email Rosemary with more information about if there are specific dates and where at the hospital you would bring it to.
Great, thank you.
We'll be back in October, but in the meantime, I'll bring that information back.
And I'll pass it along.
And we'll put it on the agenda someplace next time around.
Thank you, Wendy. Appreciate your assistance in that. Anything else for anyone? Well, my last request is that everyone has a phenomenal weekend. I hope you all had a great summer, and I know waiting for this, and I thank the entire senior advisory board for the work you do and keep up, because I know you guys were communicating over the summer to make sure we were ready for this, so there's no rest for the weary. Thank you all so much.
Thank you, Ed. Speaking of our committee, I failed to mention who they are when we started out. Francis McVetti, there he is, notorious that he is.
How you doing? Okay.
Nothing, no. No one
Ciao.
started.
Ciao.
Thank you.
Barbara?
What are we doing?
Just announce who you are.
Everybody knows who I am.
Announce who you are.
I'm Jenny Menton.
Rosemary Panio.
Winston Roach.
Daryl Lindholm, Secretary. And while I have the floor, I know we have another speaker. I want to draw your attention to a flyer that's on the back table there. Seniors have often said that we have no transportation services. Here are 5 days that there are services from the Family Services of Westchester and Ride Connect. As many of you know, I was a Ride Connect volunteer for many years. Well, they've joined forces and now have a shopping bus. Good, so you've picked it up. Great.
Very good, thank you. Anybody else?
Oh.
Deborah? Deborah Marks?
I'm Deborah Marks, the liaison to Matt Slater's office. And with the Ride Connect bus, you make sure you call to register. You can't just show up. You have to call. Right. It to says register. it on the right.
Oh.
Okay, now.
Joe Falcone, Commissioner Recreation Commission. While I have the floor, just want to remind you that Sunday, 9 to 12 at the Par 3 Golf Course, we have a hole-in-one contest, the Friends of Yorktown Parks.
Oh, nice.
Okay. Okay, sorry we kept you waiting so long. Our wonderful Yorktown Town Clerk, Diana Quast, is going to give us a little update.
So we're going to talk a little bit about the upcoming elections. If I can get my presentation to come up. Maybe not. Okay, so everyone knows that Election Day is on November 5th this year. It's also a presidential election year. The Westchester County Board of Elections will conduct a local voter registration day, 2 days actually, Saturday, September 28th from 12 to 9 right here at Town Hall in this boardroom, and on Thursday, October 10th from 12 to 9. You'll be able to fill out voter registration forms, absentee ballot applications, early vote by mail applications, and all of those will have to be left with the Board of Election representatives to go down to the Board of Elections. We'll have early voting locations, days and times. Early voting will begin on Saturday, October 26th through Sunday, November 3rd. The polling locations for early voting in the town of Yorktown are the Albert A. Cappellini Community and Cultural Center, located at 1974 Commerce Street, and Jefferson Village Annex, located at 3500 Hill Boulevard. These are the early voting dates and times. Saturday, October 26th is 10 to 6. Sunday, October 27th would be 10 to 6. Monday, October 28th is 8 to 4. Tuesday, October 29th is 12 to 8. Wednesday, October 30th is 8 to 4. Thursday, October 31st is 12 to 8. Friday, November 1st is 8 to 4. Saturday, November 2nd is 10 to 6. And Sunday, November 3rd is 10 to 6. Tuesday, November 5th is Election Day. If you're voting on that day, please go to your normal polling location. The polls are open from 6 a.m. to 9 p.m. The deadline for voter registration is October 26th. That's the last day your application can be filed and received by the Board of Elections. The deadline for absentee and early mail-in ballot applications is also October 26th. And the deadline for absentee early mail-in ballot submissions, they must be postmarked or given to the Board of Elections in person by November 5th. Westchester County there's 2 propositions on the ballot this year, so you want to flip your ballot over because on the backside typically is where they put the propositions. One is for the Westchester County legislators to serve 4-year terms instead of the 2-year terms they have now. And the other one is a New York State amendment to the New York Constitution regarding called the Equal Rights Amendment. And so everybody knows, I have a copy of this presentation on the back table, and you're more than welcome to take it with you so that you can look it up or call our office or get more information. If you want to, you can register to vote, and you can do all those things also on the Board of Elections website, which is citizenparticipation.westchestergov.com, or you can contact our office, which is 914-995-5700, or you can certainly contact the town clerk's office at 914-962-8152, or my email is dquast@yorktownny.gov. Oops. Yes. Thank you. The presentation I can put online, yes. Mm-hmm. Thank you very much. Any other questions?
No. Okay. Well, get out and vote, everybody. Thank you, Diana.
You're
Anything
welcome.
else you'd like to talk about? Diana?
What?
Anything else you have to say?
No, I'm good, thank you.
Okay, I want to tell you, mea culpa, I made a mistake on the advisory committee agenda. Our next meeting is October 18th, Friday. I wrote the 15th for some reason. So just remember that, it's the 18th. Okay? Thank you. Anybody have anything they'd like to say at this point?
Sorry, we have one more speaker here for you today. Evan Latainer here from the Office of People with Disabilities from Westchester County.
Hello.
Hello.
Thank you for having me.
Thank you.
Sorry I'm a little casual today, but I just came from a barbecue for one of our programs.
Oh, good for you.
Yeah, 500 people, so.
Wow.
Yeah. But anyway, I'm Evan Latainer. I'm director for Westchester County Office for People with Disabilities. Our office, we're an information and referral office. So basically what that is, people call us, they need assistance, whether it's for social service type of things, senior services, transportation, Medicaid, Medicare, housing, things like that. What we do is we'll provide the information. If we don't have the answers for them, we will find it, and we will also connect the individuals with the appropriate agencies, county departments, and provide that information so they can get those type of services they need. Some of the other things we do disability awareness programs. We go out into school districts. We work with children from kindergarten age all the way up to graduate schools. And we have individuals from the disabled community that come talk about a day in the life of what it is to be disabled. They're just like anybody else. We look at inclusion. One of our bigger programs that we oversee, and you talked about transportation, we oversee paratransit, the day-to-day operations for Westchester County. Paratransit is part of the public Beeline bus transportation service. Under the ADA, we have to provide service within 3/4 of a mile of a bus stop. Why 3/4 of a mile of bus stop? To me, that never made sense to me. It should be beyond 3/4 of a mile. But since paratransit was designed and started in Westchester County, every administration has given paratransit the responsibility to provide service beyond. We go above and beyond. So basically, we have over 7,500 registered riders on our service. We provide over 1,500 trips per day. We operate as early as, could be 5:30 in the morning, and we can go as late as 1 o'clock in the morning. But we have to mirror the regular fixed bus. So if there's bus service in any specific area of the county, we have to operate. So if the bus is running, you'll see paratransit run as well. If the bus is not running, we do not run. We're not allowed to. We do have extended service, and the big issue in the northern part of the county is there's not a lot of bus service
That's
for
right.
up here. They always talk about doing more, and I'll believe that when I see it down the road, to be honest with you. But our transportation officials in the county, they go above and beyond looking for different ways of how they can provide service. So paratransit, there's an application process. You have to fill out an application. I brought some literature in the back, left it in the back. Jim has it. Also has our policies, our guidelines, and some other information as well. So when you're filling out these type of applications, I always tell a person, you have your good days, how you feel, and you have your bad days, how you feel. When you're filling out this application, every day is a bad day, if you understand what I'm saying. This way, you get as much of the service that you're entitled to, and then one day when you find that you need to go somewhere but you don't have that level of eligibility, then you got to come back to us and we have to go through some steps. This avoids that. So say you think you'd ask, can you walk 3 blocks? As a senior, and I always would tell my mom, because my mom would tell me, oh, I can walk 3 blocks. I go, yes, you can, but it's going to take you 4 hours to do that. You're going to have to stop. You're going to have to sit down.
Getting
get your,
technical.
I go, so no. Say no. Say you can get to your curb or in front of your house. That will give you more of the service, okay? If you need to travel with a personal care attendant, it has a box where you can check off yes. That person can be someone that you pay to provide that service for. It could be your spouse. It could be your child. It could be your grandchild. It could be your best friend. It could be anybody that you choose. The personal care attendant travels for free. The cost for paratransit is $5 per trip. Under the ADA, we can charge twice the amount of a regular fixed bus fare. So right now, the fare is $275. We can charge actually $550, but I don't see it ever going up to that during my time. Trying to think of some other things. We are curb-to-curb, shared ride, origin to destination service. So what that means is we'll pick you up at the curb of your street address where you want to get picked up from, and we'll drop you off at the curb of where you want to go. Shared ride. You might get on the bus. There might be 2 or 3 other people on that bus. Before you get to your destination, they might drop off one person and pick up another 1 or 2 people, but they'll get to your destination hopefully within the time frame that you've requested. Origin to destination means if you need more assistance from the first outside door, the driver will meet you at the first outside door and assist you to the vehicle. As long as it's not greater than 100 feet away from the vehicle, it's a clear and accessible pathway, and the driver has line of sight of the vehicle at all times. So, like I said, we run all the time. We run every day of the year except for, at this point, we do not run on Thanksgiving and Christmas. I'm hearing rumors that we're going to be running every day starting next year, every day of the calendar year moving forward. But when I'm told that, that's when it will become official. So, we're busy. You can make a reservation up to 7 days in advance. You can make a reservation 6, 5, 4, 3, 2 the day before. You just cannot make a reservation the same day. Okay? We have. Sorry.
Is
That's
there a
okay.
specific, 1 mile, 2 mile?
Nope.
Is there-
You can go anywhere. If you're a registered rider, you can travel anywhere within Westchester County.
Oh, wow.
So,
Westchester
say if you
County.
come in and you get picked up in Yorktown,
Uh-huh.
and you want to go to Peekskill, you'll get a trip directly to Peekskill. If you're coming from Yorktown but you want to go to Yonkers, there's no bus that goes directly from Yorktown to Yonkers. There's a transfer. We have 2 transfer points. One is in White Plains at the bus terminal, and the other one is at the Tarrytown train station.
And then they would have a specific time to be picked up?
You would ask, when you make the reservation, say if I'm getting picked up, I have a 11 o'clock doctor's appointment. I'm going to tell the reservationist, you're going to book your trip with them. I need to be there. Do not say 11 o'clock. Give yourself a little cushion of time.
Right.
I need to be there at 10:45. They'll say, okay, what time would you like your return trip? You have to now calculate when you need to get picked up. So think of a doctor's appointment. You have an 11 o'clock doctor's appointment. You go to the doctor's, you're never going to get into see the doctor at 11 o'clock. If you're lucky, you're going to get into the examination room 11:30, and then the doctor might peek their head in and say, hi, Barbara. Next thing you know, I'll be right there. Next thing you know, it's another 15, 20 minutes go by. Depending on what you're going in for, it could be a 15-minute conversation, or it could be more involved. I would always say for the return trip, I would make it for about 12:30, 1 o'clock. And I say that because you might get done early, but at least when you get done, you don't have to worry about, oh, am I going to miss my trip? And then I have to call back and wait an extra couple of hours.
Now, is it
And-
$5 each way?
Each way, yes.
Thank you.
So, and then you have a place where you can sit. It's safe. If you need to use the bathrooms, they have bathrooms. If you need to use a phone and your cell phone died, you can use the office phone. And God forbid you need some help, you have the office staff and the doctor there to help you. And then you go outside a few minutes before your vehicle gets there, and you just wait. So,
Tell me, you say with people with disabilities, what about people who are developmentally disabled? Do you
fits in
handle
the
that?
same. Yep, fits into the same for paratransit. Fits into the same category.
And they would have to have somebody accompany them.
Well, not all the times. As long as they can ride on the vehicle and they can get on and off and they know where they're going,
Can
you
you-
know.
Now, we
But
have many, excuse
Go
me,
ahead.
many people that are fine, but they no longer drive.
we can.
And you can take them
Yeah,
also.
what you think? I would say about
That's a disability.
40% of our
That's a
ridership
disability.
is senior based. You know, when you think about it, a senior might be able to. They're cognitively fine. They have some physical limitations. Physical limitations is a disability.
Okay.
All right? Look at the application, and you'll just see what it says. You have to get your doctor to sign off on it as well. But, you know, we have up to 21 days to process our application. I have some staff that are really good, where as soon as they get the application in, they want to get it done, get it out, and they process it within 3 to 5 days. So
And are the forms, where are they available?
they're right back
Back.
there. You
Okay,
can actually go online. You can go to westchestergov.com, and then you go to my office's webpage, and you can find the paratransit application that way.
Not all seniors, especially elders, are online.
Yes.
Yeah.
Yeah. But you can always call. My number's there.
Good.
I'm the type of person that if the phone rings, I pick it up. My
Ah.
parents taught me just pick it up and say hello.
Yeah. Oh,
and
there
I
you
get
go.
that. And the response I get from people is, you pick up your phone? I was like, yeah.
okay.
No, that's what you're supposed to do. I'm the old school
Old-fashioned.
old school mentality.
Can you use a walker on that?
You take a walker. We have vehicles that are wheelchair accessible. We have smaller vehicles, Toyota Priuses, Toyota RAV4s, Transit Connects. And that's our paratransit, our county-owned vehicles. We have a contract with another vendor. I'll get to you. Another vendor where we have a car service. It's a private car service. It's part of paratransit. You'll see little cars with different colors running around, and it'll have a placard on the front doors that say Westchester County Paratransit.
Very good. Thank
Wonderful.
you.
And
know all
remember this, paratransit is 100% taxpayer funded. So you're a resident of Westchester County, you pay taxes, your taxes go to pay for paratransit, just like mine do. Paratransit is probably an $18+ million program that costs.
That's
You have a
wonderful.
question?
I have two questions. One is, what is the phone number, the main phone number for your organization?
My office is 914-995-2956. My direct number is 995-2958. If I don't pick up and you don't get my voicemail, I will call you back.
Thank you. And the other question I have is
public transportation, unfortunately. Just like if you couldn't pay to get on the regular Beeline bus, they wouldn't let you on, unfortunately.
So that's a fixed fee,
It's a fixed fee.
$5
Each way.
each way.
Yeah, and if you can't pay, if you have difficulty with cash, we have paratransit tickets. We have riders that can't handle cash. We're in the process of doing payments online, so people, because people will call and say, I want to pay for my mom to travel,
Right, right.
but it's hard for her with cash, so can we do this? And we started something, looking into it. I kind of passed it off to someone to move that forward now.
Okay, good,
Yeah.
very good.
And you can make reservations online as well. You go online 24 hours a day, 7 days a week. You can also, if you have a phone, you can use your phone and go onto an app and do that as well. So we try to modernize everything, and it's been positive. It has its ups and downs like everything.
Is it free when the Beeline's free in the summer, for instance?
Yes.
So that's
it's a great thing. The county administration, the county executive did a great thing on the free service, but it picked us, the number of rides, and our rides went up drastically.
So could you explain that, please? What you just said?
From July 1st to September 2nd of this year, the county executive had free service for the regular Beeline and paratransit this past summer. He did it last winter for a week or two, and then last summer, and then the previous year as well, he did it. And it was just to get people out, get the economy going after COVID, and to jumpstart that. And it was very well received. Our numbers went up in ridership, but we were extremely busy.
Now, I might have missed this answer to this question. Is there a time, like from 8 o'clock to 5 o'clock, or can you go at 9 o'clock at night, or 8?
As long as the regular Beeline service is operating, we will run as well.
Okay.
Okay. And a lot of people use paratran. We have three levels of eligibility, basically. One is temporary. People use that for up to a year's service for broken bones, hip replacements, things like that. And then they can go back, drive themselves. We have what's called unconditional. You can use the service for anything you want, wherever you want to go, travel anywhere in the county. Then we have conditional, and that has limitations. Medical, dialysis, to and from work, when it's hot outside, when it's cold and ice, busy intersections, terrain prohibits a bus, non-routine trips, things like that. And how we determine that level is the information that you put on the application and what your doctor signs off. And also remember, if you're a paratransit rider in Westchester County, you can travel and use any paratransit service in the country. So if you're going to Anchorage, Alaska, and there's a paratransit service, all you need to do is give us a call, tell us to send your ridership information to the Anchorage, Alaska's paratransit, and they'll put you on as a guest rider. We have a lot of riders that transfer up with Putnam. We have a transfer up in Putnam County at the Jefferson Valley Mall, and with Accessoride from Manhattan, from New York City in the 5 boroughs. One's in Pelham, and the other transfer point is in Riverdale. So
Who should they ask for when they call this number?
the 995-2958, that would be me.
And?
My name's Evan.
Evan.
Latainer. Think of container and just put a "la" in front of it.
You have a question back there.
You have a 995-7272 number. You might want to repeat that. That's to also sign up quarterly.
The 995-7272 number, that's our reservation line. You would call to book a reservation. You call that number, press prompt 1, and there's other prompts that is examples there. We have what Jim was talking about, renew subscriptions, is standing orders. If you're going to the same place 2 times or more a week with the same times, you could put in a request for a standing order where you do not have to call to book that trip. Basically, every quarter, every March 1st, June, September, and December 1st, you would need to call to renew that standing order so we can put it in the system.
If you're going for physical therapy at the same time, twice a week,
Right.
That would be perfect.
Yeah, but you have to show a pattern, a consistent pattern that you're traveling there for at least 3 months. All right? So,
You can call this number and ask for an application. Would that be sent to your house, an
mhm,
application?
yes. Yeah.
Can you repeat that? 'Cause
To get an application, you can call me. I'll put it in the mail for you. You can call the 995-7272, and I believe that is prompt 3. I was close. 3, and one of my staff will put an application in the mail. You can actually, for those of you who do go online, who are technology savvy, you can go online. You can print out an application if you have a printer and you want to do it that
It would
way.
really be a good idea if, like, I don't have a need for it, like, say, right now.
Mhm.
But to file an application, so I would be on file.
Yeah.
That maybe
Wouldn't
a
hurt.
week or so later, it would already be on file.
Right. I mean,
Okay.
you don't need. You can use paratransit for whatever you want. You don't have to use it 1 day a week. You can use it
Right.
10 days a week. Use it as much as you want. It's public transportation. The eligibility is good for 3 years. So, in 3 years, probably a month before, you'll get a recertification application. It's 3 pages. Just fill it out, just so we know you're still around, you still want it, and we'll basically renew it and put you in the system again, and there'll be no changes to it.
Good, that's wonderful.
So,
How do we get to Fairbanks?
how do you get to what?
Fairbanks.
That you're gonna have to walk.
Have to walk there, okay.
Well, you might be able to take paratransits from different municipalities in different states.
3 years later.
It'll take you 6 years, yeah.
Very good. Well, thank you
So,
very much. We
No, but thank you
appreciate
for
the
having me.
information.
And Jim and I have known each other for, how many years? Well, yeah, well, when I ran the camp, right? Yeah, I used to run a camp program at Cerebral Palsy Westchester, and Jim was one of my staff.
Oh.
And we just happened to run into each other at a rec.
You talk
There
about
you go.
You talk about people with disabilities.
Mm-hmm.
What about people who are developmentally disabled and cannot be alone?
They'd
have
they
someone
would have to
with
get,
them, yeah.
they would basically be, hopefully, they would be in some day program.
Right.
And they would get
Have it on the mic.
someone with a developmental disability who needs this, they need supervision and stuff, and families have to go to work. Hopefully, those individuals will be in a day program and receiving services, whether it's a pre-vocational, it's ADA skills, things like that. It's community inclusion, recreation, stuff like that. Some of those agencies would be ARC of Westchester, could be Cerebral Palsy of Westchester, YAI. There's a lot of them. And if just out of curiosity, you can look at these agencies. On my website, we have what's called the Disability Resource Guide. And I call it one-stop shopping. We created it years ago, where it has lists of all the different agencies in the county and has their mission statement, their contact information, the different programs that they offer, the services they offer, the ages that they provide service for, and the different disabilities that they focus on. So, it's a great resource for people that are looking for assistance for their family
But
members.
we've come a long way.
Yeah.
Come
We
a
have.
long
But
way.
we still
I
got a
know
long way.
I grew up
We-
with a brother who was
Yeah.
disabled, and my mother really had to do everything.
Yeah.
Everything.
Well,
You've come a long way.
I've been working with the disabled community since I was in college. So I've been with the county. I'm in my 22nd year. I was at the CP for 17 years.
That's wonderful. Wonderful.
So we've come a long way, but we still got a way to go.
Great,
just
it's
like
a
with
great
other-
asset. If you have that need, believe
Yeah.
me, it's a great asset.
Yeah.
Well,
So-
thank
but
you
thank
very
you for
much.
having me.
Appreciate it.
Nice to
Thank
meet you.
Good to know. Now I have to find out how late.
We'll see you on the 18th. Remember, there's an error on the sheet. It says 15th, but we are actually meeting on Friday, the 18th. Thank you.
Okay.
Thank you.